The Ministry of Health, in partnership with the Uganda Cancer Institute and the Palliative Care Association of Uganda, will host the 5th Uganda Conference on Cancer and Palliative Care under the theme Embracing Uniqueness and Empowering Communities. Scheduled to take place from 10th to 12th September 2025 in Kampala, the conference will highlight the importance of community-led solutions in enhancing access to care, promoting equity, and delivering holistic support for individuals living with serious illnesses.
The 5th Uganda Conference on Cancer and Palliative Care will take place once again on the 10th and 12th of September 2025 at Speak Resort, Munyonyo. Uganda records almost at about 34-36 new cases of cancer annually and over 24,000 deaths each year. And only 20% of the patients reach the Uganda Cancer Institute for treatment, which means that 80% of them die before seeking care. I also want to make mention to you that 30% of the cancer definitely are preventable, and 30% of them are curable.
The Director General of Health Services at the Ministry of Health, Dr. Charles Olaro, noted that in Uganda, community involvement in the fight against cancer remains low. He added that many patients seek medical help only when the disease has already progressed to late stages.
Strong community involvement improves early detection, because as I did mention in the beginning that we have only a 20% survival rate, which means that most of the patients come when it's too late. So we really would want that we do early detection. I've also mentioned that 30% of the cancers are curable, so early detection is, but also adherence to treatment and holistic support.
The Executive Director of the Uganda Cancer Institute, Dr. Jackson Orem, expressed optimism about the conference, emphasizing its importance in improving cancer prevention, care, and treatment.
This conference has actually been meeting exactly that need, and to have had it now going into the 5th, that means everyone has seen that actually there is value in holding these conferences. Of course, number one is to kind of come up with areas that are new, scientifically, socially, educationally, and name it, but focusing on cancer and the discipline of palliative care.
Similarly, Mark Mwesiga, the Executive Director of the Palliative Care Association of Uganda, outlined what participants should expect during the 3-day event.
The amount of work and research and data and information that you will find at our conference will be beyond. It will touch cardiovascular diseases, of course it will touch cancer, it will touch chronic respiratory diseases, it will touch HIV and AIDS, it will touch diabetes, it will touch sickle cell, it will touch aging, it will touch survivorship, it will touch real life stories of people who are in the community who are spending money on long-term care within our country and within the East African region and beyond.
So many people get cancer, so many people survive, and people will wonder who are those who survive. I'll be leading a delegation of survivors in the conference to share unique experiences of how they've dealt with the stigma, how they have dealt with the challenges of accessing care, and true stories of survivorship.